Okay, so women coming with a lump on their breast and with fear of cancer to a family physician's clinic is a very common presentation. But not every lump is cancer. But still, every lump should be evaluated for cancer because breast cancer is the second leading cause of death for women who suffer from different kind of cancer. Hence, it is the responsibility of every physician to evaluate in such a way that his efforts can maximize the detection of cancer, avoiding unnecessary tests. Determining a breast lump in a premenopausal woman is a very challenging task. The glandular tissue of the breast is mostly nodular, and this nodularity is more marked in the upper quadrant as well as in the inframammary ridge. Hence, during the menses, the nodularity waxes and wanes, which means it swells up and it shrinks. And this is the reason most of the times it is misconceived as a lump. So, if it is maximizing and minimizing, that is, if it is waxing and if it is waning during menstrual cycle, it has to be considered normal and it should not be misconceived as a lump. So, what can be the reason of this lump? The most common reason can be a fibroadenoma, which is not cancerous. It can be a simple cyst, which again is not cancerous. It can be a fibrocystic mass, that is a benign fibrocystic mass. It is not cancerous, but it may increase the risk of cancer. And fourth reason, it can be a breast cancer. A very important tip before you call the patient for physical examination of the breast lump, always call the patient on the 5th or the 10th day of the ongoing menses. Because as we have already discussed, that the lump which is in the upper quadrant or in the inframammary ridge of the breast, okay, if it is normal, it is because of the nodularity which waxes and wanes during the menstrual cycle and which can be misconceived as a lump. So avoid these mistakes and call the patient on the 5th or the 10th. Now let us discuss about breast cancer. From the total number of cancers that women face from, 1/3 are breast cancers. Breast cancers are mostly diagnosed on the upper quadrant of the breast. Hence, it is very important for you to remember this while you are physically examining the patient. These palpable masses are discovered by the patients first and later by the doctor. So it is very important point to note that only 40% of the palpable masses are further diagnosed as cancer. This introduces us to the importance of mammography screening and USG. It is extremely important to remember that 60% cases of breast cancer, they don't come with a lump presentation. Instead, they are diagnosed on routine mammograms. They are diagnosed on the basis of nipple discharge. They are diagnosed on the basis of changes in the skin of breast, and very important point to remember, on the basis of axillary adenopathy. Now, skin dimpling, nipple retraction, and changes in the color of the skin are signs of later stages of breast cancer. One more gem to remember: invasive lobular carcinoma is extremely difficult to diagnose than invasive ductal carcinoma. This is because invasive lobular carcinoma can only present itself like a thickening instead of a lump. Hence, it becomes very difficult to physically examine this case. So let us discuss some risk factors for breast cancer. If the woman has had her first childbirth after the age of 30, she has the risk to develop breast cancer in the future. The woman is above age 50. The woman has had exposure to ionizing radiation. The woman has had the history of benign fibrocystic masses. We have already discussed this, that if a woman has benign fibrocystic masses, the risk of her developing breast cancer in the future is more. Nulliparous women, women who have never given childbirth, or women who have never got the opportunity to breastfeed a baby, women who have history of breast cancers among the relatives and among the family. Hormone-related therapies and obesity also contribute a large number of cases in increasing the risk factor to develop breast cancer among women. Hence, women should exercise, they should get involved into physical activity and maintain their weight. Now, these are the probable risk factors for breast cancer. If the woman has never breastfed, if the woman has huge amount of alcohol consumption, diet high in fat, low in vitamin A, beta carotene and folate can also cause breast cancers. as we have already known from newspapers when Angelina Jolie had breast cancer, that mutation on the gene BRCA1 and BRCA2 can cause breast cancer. Breast cancer can also be caused because of exposure to certain kinds of chemicals. It has also been observed in certain cases, and there are various theories that if menarche has happened before 12, that is the first menstrual cycle, or menopause has taken place just after 45, this also increases the risk to develop breast cancer. Hence, it has to be kept in mind the dates when you had your menarche or the date when you stopped having your menses. Again, on mammography, if the tissue of the breast is very thick, even that gives a signal that the person has certain risk of developing breast cancer. So, what questions should a doctor ask to a patient who is coming for the problem of a lump on her breast? First of all, you ask the patient to point the lump. After she points the lump, you document it pictorially on a case paper. Second, you should ascertain the size of this lump. You don't need to measure the lump. You just need to imagine the lump, whether it is pea-sized or it is a walnut-sized or grape-sized. Thirdly, ask the woman if she has pain in the lump. Fourth, ask the woman about the status of her children, how many children the woman has. Also ask what was her age during her first childbirth. As we have already discussed this, that this becomes one of the most high risk factors to have breast cancer. Also ask whether this lump waxes and wanes or the size of this lump changes during menstrual cycle. Again, we know that the nodularity is more marked towards the upper quadrant and inframammary ridge of the breast, and this waxes and wanes during the menstrual cycle. So if this is happening, this is completely normal. Other questions: did she ever have exposure towards ionizing radiation or some sort of chemicals? Did she breastfeed her babies? Asking her about her ovulatory status, if she is premenopausal. Most important question: does she has history of family? Does she has family history of breast cancer? Is any of her relative has been diagnosed with breast cancer? This is very important. Also, ask her about the age right now. If she is about 50, then the risk is more. The optimal time to physically examine the breast is 5 to 10 days after the ongoing menses. As we know that during the menstrual cycle, the nodularity can wax and wane and give a picture of a mass, and it can be misconceived as a mass by the patient. Second, when you observe the patient, observe for the symmetry of the breast, for the color of the skin of the breast, the texture of the skin of the breast. Observe for nipple retraction. Observe for skin dimpling. Patient should be physically examined in all three sitting positions. Position number 1, where the patient is seated with her hands on the sides. Position number 2, when the patient is made to sit and the hands are over the head. And position number 3, when the patient is made to sit with her hands placed on the hip and pushing inwards. This position causes the contraction of pectoralis major muscle. It is also very important to observe the nipple areola complex. In the supine position, the woman should be asked to raise her ipsilateral arm over the head for palpation. The palpation should be done on with 3 fingers, the bases of these 3 fingers in clockwise rotation. This is called as the triple touch technique. It is completely unnecessary to squeeze the nipple for discharges if the female is not complaining of any discharge coming from the nipple. It is also very important to palpate lymph nodes, mostly the infraclavicular, the supraclavicular, and the axillary lymph node. Benign fibrocystic masses are the most common masses or the cause of lump on the breast. The hallmark for benign fibrocystic masses is bilateralism. It is present on both the breasts. The very important point to remember about fibrocystic masses of the benign format is they increase and decrease during menstrual cycle. Also, there is pain during menstrual cycle. Again, one has to remember that this occurs in the age group of 35 to 55. This is because benign fibrocystic masses need estrogen for them to occur. The way ahead to diagnose benign fibrocystic masses is through fine needle aspiration cytology, that is FNAC, and mammography. It is also important to know that benign fibrocystic mass, they increase the risk of cancer. Again, the second cause of lump in the breast is fibroadenoma. It is the most common cause of lumps in the breast. It usually occurs in young women. The age group for fibroadenoma is 20 to 35. The lump is mostly 2 to 3 centimeter long, but it can increase to large sizes. Uh, the most important point to remember about fibroadenoma is that fibroadenoma can present itself as hardened calcified masses in postmenopausal women, and they carry zero risk of developing into a cancer. Just like benign fibrocystic masses, the fibroadenomas also go through fluctuations in size during the menstrual cycle. The same is the case with the cystic masses of the breast. But structurally, the cystic masses and the fibroadenomas are different. Fibroadenomas are firm, smooth, and rubbery, whereas the cystic masses, they are firm, they are non-tender, and they are mobile. Another thing, cystic masses, they are mostly common in premenopausal women, but they are uncommon in young women and in postmenopausal. So the modes of investigation of the breast cancer or any lump should be done via USG, mammography, core needle biopsy, fine needle aspiration biopsy, and excisional biopsy. So we'll be summing up this lecture with this table, which is going to guide you all to how many times every category, according to the risk factors, should go for mammography and should go for physical examination of breast. So this table, everyone can follow and decide for their own case. Thank you.